Retinal vasoproliferative tumor in association with neurofibromatosis type 1. Greetings from Colombia. This is a 61-year-old female patient with a history of progressive decrease in vision in the right eye. No past medical history. Her visual acuity is hand motion in the right eye and 20/40 in the left eye. Cataract is evident in the anterior segment. And in the posterior pole, pale disc, areas of fibrovascular traction from the macula to the inferotemporal region where an elevated vascularized pigmented lesion is evident. Left eye excavation increased. The white field color mosaic of the right eye showed fibrovascular proliferation and a raised reddish nodular lesion inferotemporal with areas of exudation. The left eye showed increased excavation. This unilateral raised lesion in the inferotemporal region showed the presence of a feeder vessel, subretinal fibrosis, exudates, areas of bleeding, and pigmentary hyperplasia. The fluorescein angiography showed slow filling in the early phases and leakage in the late phases, with an undilated feeder vessels and telangiectatic vessels around the lesion. The structural OCTV scan shows a large area of macular esquisses due to traction, with the inner layer significantly compromised and the outer bands barely detectable. Finally, the choroid is thin. In the wide field 3D image, we can observe the significant area of traction over the macula, providing valuable information in case of planning a surgical procedure. A radial OCT scan shows an elevated lesion dependent on the neurosensory retina, with a hyperreflective halo that generates posterior shadowing. Some hyperreflective space can figure in cysts and areas of traction in the retina. The correct diagnosis in this case corresponds to vasoproliferative retinal tumor. Now, vasoproliferative retinal tumors can be primary, accounting for 80% of cases. They are benign, involving the neurosensory retina, typically solitary, with no gender predilection. The usual location is inferotemporal, and they occur between the 4th and 5th decades of life. Secondary tumors account for 20% of cases, most of which are characterized by areas of retinal ischemia, neovascularization, and exudative retinopathy. They are associated with retinitis pigmentosa, intermediate uveitis, Coats disease, and other conditions. The examination revealed these nodular lesions corresponding to multiple neurofibromas. The above findings allow us to obtain the correct diagnosis compatible with secondary vasoproliferative retinal tumors due to neurofibromatosis type 1. Given the involvement of the macular area, the patient undergoes surgery. Trocars are introduced, ensuring that the infusion is in the vitreous cavity, and phacoemulsification with insertion of an intraocular lens is performed. Posterior vitrectomy is initiated from the center and then towards the periphery to avoid generating traction on the macular area. Subsequently, the elimination of membranes is initiated, aided by intraoperative OCT to achieve better visualization of the planes and prevent damage to the retina. Finally, laser is applied over the entire tumor area and surrounding area. Intravitreal anti-VEGF is administered, subtenon triamcinolone antibiotic, and the surgery concluded. This is the postoperative result with the attached retina and anatomical and functional stability for our patient. His best scored visual acuity is 2400. Retinal vasoproliferative tumors are an important ocular finding in patients with neurofibromatosis type 1 and can cause exudative retinopathy, vitreous hemorrhage, and visual loss. Early detection of this association and prompt initiation of treatment may prevent vision loss and blindness in affected patients.